So we're actually asked to talk about the anatomical basis for the what avascular necrosis of the scaphoid bone. Why it is always occurring at the scaphoid bone. I think literally that's what they mean. So the thing is, if you are also talk about the avascular necrosis of the scaphoid bone, you are simply going to talk about what how the scaphoid bone can get fractured, and if the scaphoid bone gets fractured, how this affects the blood supply of the scaphoid bone. If you relate this like this, then you are perfect to go. Right? So if you observe very well, you could look at the what blood supply of the scaphoid bone. Right? So we are going to talk about something on the blood supply. So you should pay attention to that. So the avascular necrosis of the scaphoid bone is good that you acknowledge that another name is what Preiser's disease. Okay, the person marking your script will be very happy with you. Now it occurs due to what the unique blood supply of the scaphoid bone. So unlike other bones, the blood supply of the scaphoid bone is quite unique. All right. So if there's a fracture, it also affects it. Now here's the anatomical basis. Now for the blood supply, there is a retrograde blood supply flow to the scaphoid bone. All right. So the scaphoid bone receives its blood supply from the dorsal branch. That's at the back, right? From the dorsal branch of the radial artery. Okay, this is the what? Dorsal branch. When they say anterior, okay, they say ventral is at the front, dorsal is at the back. Dorsal means posterior, okay? So it's receives blood supply from the dorsal branch of the radial nerve, which enters at the waist of the scaphoid and travels proximally, travels to the front, or travels near you. Okay, so now the whole thing is this. Can you see how the blood supply is entering? Blood supply is entering from the back before coming to the front. All right. So now let's talk about this now. Now, proximal pole vulnerability. We are saying because the blood supply comes from distal to the proximal pole, any disruption, like a fracture at the waist, can now compromise the blood supply to the proximal pole, making it more susceptible to avascular necrosis, which is what they call AVN. You get blood supply is from the back to the front. Okay, so any injury at the waist is passing at the waist. Okay, and the waist of the scaphoid is easily fractured. So because the blood supply is passing at the waist of the scaphoid, it can now be affected. Okay, so you can see the different types of fractures for the scaphoid. You have the distal fracture, which is very rare, at the proximal fracture, which is very rare. The waist fracture is the most common type of fracture of the scaphoid. You get it? All right. So what is the mechanism of this avascular necrosis? Of course, a fracture, especially at the waist of the scaphoid, can disrupt the blood flow, leading to ischemia. What is ischemia? The blood supply is cut off. All right. So bone death now. So prolonged ischemia can result into the death of bone cells, causing avascular necrosis. What's the clinical presentation? It will present with pain and swelling. All right. So patients often present with what? Radial sided wrist pain and swelling. Okay. So you could just go on to talk about radiographic findings. This one you're just trying to what? Impress the examiner. All right. So you see that imaging studies like X-rays and MRI can show sclerosis and fragmentation of the what? Proximal pole without evidence of a fracture. Well, just leave these radiographic findings out. Okay, just leave the radiographic findings out. Leave the clinical presentation at the pain and swelling. All right. So I think this is how we can be able to relate the blood supply to the scaphoid and how scaphoid avascular necrosis actually what occurs.